Yes, hey, hello, welcome back to the program. It's our special segment, See the Stories, and you're still watching our conversation with Dr. Aminah, talking about the International Anti-Drug Day for today, and we're talking about a very intricate or tangled, or what?
Tangled, yeah. It's a very difficult situation. I mean, hearing from Dr. Mia, but effort still needs to be done. And I think it's a responsibility of many, not only the family of the drug addict, right? So now we want to go back to our discussion, Dr. Mia. If you could tell us, what are the early signs that somebody might relapse to go back, jumping into that deep pit into addiction?
Yeah. Okay, first of all,
relapse stage,
yeah. Okay, first of all, I would like to differ relapse and lapse. It's different,
right?
Because relapse happen after recovery, after some time that they stop.
So they stop completely, and then there was a break.
There are some breaks, and then they keep using it again.
All right.
But there is some slip or lapse. They already on the treatment to stop the drug or lower the dose, and then they think to, oh, I want to use it again. I don't feel comfortable emotionally or physically, something like that. One time only, and after that, during the treatment, we also teach them how to handle the condition like that. So one slip, it doesn't mean that
it's failing.
It's failing, yeah. It's not the end of the treatment.
Yeah.
It's part of the process actually for having slip or lapse.
Right.
But if the lapse keeps happening again and again for quite some time, then it's relapsing. And then, so the warning signs, including emotionally, physically, and behaviorally. Like emotionally, they keep craving it more and more again. Maybe the emotion went wild sometimes, like, like in PMS, for some women, keep hard to sleep. And then for the body, they can be, sometimes they can be insomniac, don't want to eat more, or it's leading to, anxiety sometimes.
Right.
So they think, I have to take the drug again to lose this anxiety, because it's very, very uncomfortable.
Yeah.
But then again, we have to know the duration and the dose of the drugs they keep using it again right now. Yeah.
Is it bigger or smaller than
Yeah.
before? Right. Ooh.
Still complicated.
Yeah, it is
But
still
we need to
complicated.
learn and to get more understanding about it.
Yeah.
So, before we end our discussion today, our friend Kai will join with us and challenge us with a game, Myth or Fact. Come, Kai. So please, you.
Hello. Hi, Doctor.
Hi.
Well, this has been a very, very interesting conversation, and I am keen to see how much you both have learned.
Oh, okay.
Okay.
So,
We're trying to prove that we
Are we
get
going to
more
be a lapse or
understanding.
relapse?
well, today we're going to have myth or fact statements, and both of you are going to determine whether you think it's myth or fact, and the statements are going to be presented on this plasma here.
All right.
So, Alia, Akhil, are you ready?
Yeah.
Let's look at statement number 1.
Ready or not?
Here we go.
Myth or
Myth or
fact?
fact? All the drugs have the same level of addiction.
Myth, I think.
Interesting.
Same level? No, different.
Myth. So, Doc, what do you think? Is it myth or fact?
Yeah, it's a myth.
Yay!
So how should we see the level of
Actually,
addiction in terms of drugs?
yeah, actually we have so many drugs, right? And few of them have very big occupancy on the brain receptors.
Oh.
Very, very big and hard to lose, like heroin.
Okay.
If you ever heard about heroin addiction, they can die if they stop the drugs abruptly like that. Yeah. So it's not safe because it's very, very big occupancy. And cigarette also, tobacco.
Yeah.
But most hypnotic sedative, nowadays very, very addiction of it. It's not that big as heroin actually. So I have a different level of addiction.
Right.
And even after addiction itself, there are severity for them, from mild to severe. So
occupancy and
yeah,
severity.
it's depends on the individual itself also.
Right.
Yeah.
So before we go to the next question, besides heroin, should we know about like the newest drugs that has the same effect like heroin? So we can more alert about it?
Yeah, as far as I know, heroin has the biggest occupancy on for the brain receptors or opioid. And as the world change, mostly they use now is anxiety drugs.
Such as?
Such as if you have ever heard Alganax or I forgot about the name, but it's Frixitas, something like that.
Okay.
Yeah,
It's really interesting.
yeah, it's used for misuse.
Misuse.
Yeah, definitely.
Yeah.
Drug misuse, also very, very important. Well, next statement, please.
Okay.
Both of you get point.
People
People who are addicted to drugs can quit on their own without medical assistance. Now,
didn't
is
answer
that
that, Liz.
possible?
Yeah, but
What do you think, myth or fact?
They need helps, including,
They need help. Yeah, they need help.
I don't know,
They need help, right?
Wait,
right?
Why is it a myth?
People who
because
are
they
addicted
say
to
they can
drugs
quit on their
quit.
own. Because it
I
says
think
they
it's
can
myth.
quit
Oh,
on their
yeah,
own.
it's a
So,
myth. Yeah.
okay.
I think it's-
So you both say myth. Doctor, what do you think?
Okay, it's actually correct.
So
Yeah.
they do need.
Yeah, they mostly need help. But let me explain about addiction. Most people thought that if we use, some people use the drugs, even one time it called addict. It's not like that. So there are some recreational use, really addicting or not. So if it's recreational use, they can stop by just like that because
don't need any
they're not addicted to the drugs because of the duration or maybe the dose. But if they already used it for a very, very long time, years,
Then it's an
and very big dose, and then they actually need help because of the occupancy on the receptors. When we just stop it abruptly, they can cause some withdrawal syndromes that might be very uncomfortable for them and can lead to death for some people. So it's not really recommended. So seek help for that.
Occupancy
So-
in the brain.
Yeah.
One more little question.
Yes.
So even if it's recreational purpose, I don't know. Should we or what should we need to understand about it? Is it still illegal, legally, against the law, or that's why some of the artists, for example, they go to the rehabilitation only because of that?
Okay. As far as I know, even if you use it as recreational use, how can you get the drugs? In Indonesia, I think the law is not allowed, so it's
Allowing it.
still illegal.
Yeah.
But it's different if they already have the drugs from the doctor and then they misuse it. They can get it legally from the doctor, right? They pay the money in the right way, but they just use it in an appropriate way. So
Misuse.
it's misuse. That's what we call misuse.
That's a slight difference.
Yeah. So it's really different how they can get them, but it's mostly it's illegal.
Illegal.
Right.
Right.
Okay.
Okay. We have one more
Okay.
myth or fact statement. Let's see. Relapse is a normal part of the recovery process. So is it
Relapse.
myth or fact?
Relapse is a normal part.
I think it's normal.
I think so. I don't know. what
Knowing
is-
that it's hard.
You have like the same heart today. There's
Yeah.
no,
You're Pisces.
Yeah. Okay.
Yeah, we are.
Yes.
A twin soul. Let's see, doctor. Is it a myth or a fact?
Yeah, it's actually the fact.
Yeah.
Yay.
Because as I said before, people can have relapse for some time after recovery, so it's really a normal process. But it doesn't mean but it doesn't mean that they are failing for the treatment and they as bad as they before. But one thing that we have to know is that relapse can be more dangerous than before if they use the same dose. An example, they use these drugs 1 milligram, maybe 6 milligram before, and then after recovery, they use it as much as 6
again.
Yeah, and then they can go off dose because the occupancy already lessened, right? The receptor. So it's quite shock for the brain after 6 milligrams for, for some time that we call it remission actually. If it's less than a month, a year, less than in a year they don't use it, we call abstinence. And after that, we should, if you want to use it just little by little actually. If too much, they can lead to intoxication, and also it can lead to death actually if too much. Depression, for the breathing, depressed, hard to breathe sometimes.
The world of addiction is very difficult.
Yeah.
Even
Complicated.
the rehabilitation as well is it's not easy at all. Well, Dr. Mia, thank you so much for coming by to
Thank you. Thank you for having me.
Thank you, Dr. Mia.
Yeah.
All right. So, we're still going to come back with a lot of interesting news, but stay here. See the stories. We'll continue after the break.
Don't go anywhere.